we turn our attention to the one and only Dr. Fine. And let me give you just a short introduction to him. Stand by. Dr. Fine has served on the cabinet of Governor Lincoln Chafee as the director of the Rhode Island Department of Health from February of 2011 until March of 2015, overseeing a broad range of public health programs and services. He is currently the chief health strategist to Mayor James Diossa and the city of Central Falls here in Rhode Island. He is a writer, a community organizer, and a family physician, and a public health provocateur. If you haven't already picked up his most recent book on Amazon entitled The Bull and Other Short Stories, you can find that on Amazon. I have read through it. It makes for excellent Shabbat reading. And after you participate in services, then I invite you to read that book as you enjoy the rest of your Shabbat. Dr. Fine, I put some slides up here that I'm hoping will sort of give the current status of where we are in terms of COVID spread in the community. And if you want to sort of help interpret what these charts mean for us, I think it's a nice place to start, and then we can start asking some questions. As a reminder, if you have specific questions, you can put them in the chat box, and I will moderate that as we go along through this program. So without further ado, Dr. Fine, do you want to go through these charts with us?
Sure. This is what I look at every day of the week at about 1:15, which is when they are updated in general, though these are the weekly charts. I also have for you the daily numbers. The weekly charts show that number of new cases by week are up to near record levels. That new hospital admissions by week are down a little bit, but I wouldn't expect that trend to continue. I would expect the hospital admissions to rise again, as their trend usually follows the trend of new positive cases about 2 or 3 weeks later. And the percent positive test of the cases per 1,000 population by week, new cases per 1,000 by week is also elevated, which we'd expect. It's a sort of more normalized number, remembering that Rhode Island has been among the most infected places in the nation since we spoke last, and probably was among the most infected places in the world for a couple of weeks. It's been down, but it's going up again. And we expect that it will continue to rise. Number of new cases, number of hospitalizations, and very unfortunately, the number of deaths will continue to rise in the couple of weeks after Christmas and New Year's, when people got together again. And I expect these numbers, unfortunately, to go higher than we've ever seen them, and expect that to happen somewhere between January 15th and January 31st. In the last, or a day ago, we had 1,564 people test positive of about 20,000 tests. I'm very unfortunate, 20 deaths. We've been seeing 15 to 20 deaths a day for a week or two, or probably 3. We had 405 people in the hospital, which is down a little bit, but unfortunately I expect that to rise again. And we as a state have had 1,890 deaths. Around the world, there have been 87 million people who have tested positive, almost 1.9 million deaths. In the United States, we've had 21 million people tested positive, and 366,000 deaths. At this rate, we expect to top 400,000 deaths by the end of January, and likely 500,000 deaths by the time spring rolls around and the number of infections drop again, as we hope they will. The good news is that the vaccine has been released. There are two vaccine made by 2 manufacturers, Pfizer and Moderna. They are both mRNA vaccines, a relatively new technology. The number of doses has been that have been distributed is smaller than we hoped. We've been promised 20 million by the end of 2020. When I last looked, we were about 4.5 million doses distributed in Rhode Island. We got about 25,000 doses in December, and we're expecting 14,000 doses a week for at least January, and hope and expect that number to grow. We also know that there are at least 2 more vaccines that are in the pipeline, and one made by AstraZeneca and the other made by Johnson & Johnson. And we expect those will be ready for release by the end of April. We have a carefully prioritized list of who in Rhode Island is slated to get this vaccine first. We first vaccinated frontline healthcare workers, and then we are now working to vaccinate people in nursing homes. And hopefully we'll soon vaccinate those over 75. The population of Central Falls, where I work, which has been the most affected place in the state. And then hopefully soon after that, we'll see vaccinated teachers and frontline workers. There are about 150,000 people in what's called phase 1. The good news is vaccine is coming. The bad news is that 150,000 will likely take 10 to 12 weeks to vaccinate based on the flow of vaccine that we now get. The rollout of the vaccine process in the state has not been, in my view, terribly smooth, with lots of confusion around it, and I wish I could address that confusion here, but I don't think the plans for how and when who's going to get vaccinated have yet been made public by the state. The good news is that the Moderna and Pfizer vaccines seem somewhat better tolerated than we had heard earlier. Not many people are having severe reactions, though it wouldn't surprise me if over the course of this rollout, we do have some problems with it. The good news is that we have, sort of 2 vaccines now, 2 in the pipeline soon, and then another couple of vaccines in process before long. So even if one runs into a problem, we have some backup vaccines. The challenge is just getting enough vaccine into the state quickly enough to vaccinate the population. Unless something changes, I'm not expecting that to happen. I'm not expecting that to go faster than through, I suspect it will take through September. But I hope and pray that, we'll start getting more vaccine and get it faster so we can get the population vaccinated all together. I can't tell you where the vaccinations are going to take place. Up to this point, the traditional place for vaccination, which is doctors' offices, haven't been involved. So I'm hoping that there will be a mass vaccination process, but that hasn't been made known or available yet. The distribution, the prioritization, this has been debated for some time. There was a National Academy of Medicine panel that made some proposals in September. They got modified somewhat at CDC and by the FDA, but even so, they're voluntary. It's the governor of each state who has the ability to set the prioritization, understanding that the vaccine comes to the state by and large. There's one small exception, and that's that retail pharmacies, Walmart, Walgreens, and CVS have a contract to vaccinate nursing home residents, and they're vaccinating those people right about now. I think that's the basic update. Um, if
So,
I had to guess, I don't think we will be back to normal, what looks like normal life until summer, unfortunately. And I would emphasize that it is very important that people continue to mask and engage in mutual protection. My friend Morty Miller pointed out that uh, social distancing uh, and herd immunity are both sort of off-putting terms. So I'm trying to use mutual protection instead of social distancing. But I think the import is the same. Why don't I pause and take questions?
so we'll ask people if they want to put comments into the chat box. Then we can sort of start triaging them and sending them to Dr. Fine. I'm going to give you a softball like I did last time that we meant. Once you get vaccinated, does that mean you're free to roam around and meet with your family and do whatever you want, and you can just sort of re-engage in life as we used to? Or how will your life change after you get vaccinated?
Well, let me hedge the question a little bit. It takes, depending on which vaccine you get, either 5 or 6 weeks for you to become fully immune. So if you get vaccinated today, we don't consider you fully protected until after your second vaccine, which is either 3 or 4 weeks later, and then 2 weeks after that. So if you get vaccinated today, my answer is don't do anything different for 5 to 6 weeks, depending on which vaccine. Once you are vaccinated, then as far as I'm concerned, other than continuing to mask, um, I think it is reasonable to start doing some of the things that you used to do. The one big unknown about the vaccine, we know it protects people from getting symptomatic COVID-19, but we don't know whether it eliminates the carrier state. That is, we don't know whether someone vaccinated can still spread can still spread virus. So until the bulk of the population, 80 to 90% of the population is vaccinated, we're going to, I think, continue to suggest or even require masking and social distancing to protect others, even though each individual who's vaccinated will be at substantially lower risk from getting infected themselves. These vaccines, the two vaccines that have come out first, offer a 94 to 95% effectiveness in protecting you uh, against viral infection, which is one of the most effective. They're one of the most, or they're two of the most effective vaccines against any disease that we have.
So one of the things that we don't know yet is once you have the vaccine and you have had your second dose and you followed the protocol, um, can you still get coronavirus and pass it? What you're saying is we're not sure if you can still get it and pass it to other people, correct?
Right. And what the evidence suggests that you don't get symptomatic disease, that you don't get sick from it, but it doesn't mean you can't get, the virus, particularly having some live in your nose. And it doesn't mean yet, we don't know yet whether the vaccine prevents you from spreading it to other people.
How will people learn when they can make appointments to get the vaccine? In other words, should people be calling their PCPs, just reading the newspaper? Are there lists people should be trying to get on in order to get the vaccine? Or if people are interested in getting the vaccine, what should they be doing right now besides being patient?
Being patient. I don't think there is anything to do right at the moment. I think state government and the Department of Health is trying to figure that out. But no announcement has been made, to my knowledge, about how to approach it. I think what they're trying to do is isolate small groups of people who need the vaccine and open it to them in a directed way. That's what's been happening in Central Falls. But there is no big waiting list and no process at the moment. I am hoping that will change and change soon, because I think the thing that helps people deal with this is to know when the the light is coming at the end of the tunnel. And even if it's 4 months away, you want to know when it's going to be your turn. But we haven't had any direction about that at this moment in history.
People who have had a positive coronavirus test, should they still get the vaccine?
The current belief is yes. And the reason is that immunity to the virus from disease appears to last a couple of months, but we don't know how long. There's a belief, I think we're going to have to see if it's validated by further study, that immunity from the vaccine seems to be more powerful and long lasting. So the current argument is even if you've had coronavirus once, you should probably get vaccinated. That may change, as we see the speed of infection that we get with the new variant of the virus. And there's an ongoing scientific discussion about whether people can postpone doses or shrink doses to make sure that more people get vaccinated. We'll just have to wait and see how the science answers that. At the moment, the FDA is quite adamant that people should get the doses, if it's a 2-dose vaccine, should get 2 doses at the prescribed time. In England and Great Britain, they've changed that to be able to get more people vaccinated more quickly. We'll wait and see what happens here.
Are there any pre-existing conditions that should concern people about getting the COVID vaccine?
The most significant one is serious allergic reactions to the constituents of the vaccine, what's in the vaccine. And the most notable one is PEG, or polyethylene glycol, which is actually the active ingredient, if my memory is right, in Miralax. And I think it's also used in cars. Who knows?
It helps keep everything run regular. Yes.
Yeah, that's right. We want everything to run regular. Anyway, we don't. That's the major contraindication. Most people are saying that if you're on a blood thinner, you should probably talk to your doctor before getting the vaccine. I'm not sure I totally understand the logic of that, but there are, other than having a severe allergic reaction to PEG, or people who have had a severe allergic reaction to another vaccine, I think there are basically no other contraindications at this point in history, though that may change over time. And even the severe allergic reaction to a different vaccine is kind of a relative contraindication. And some people would just say, talk to your doctors. My memory is correct. I think Lifespan has set up a special vaccination clinic for people who have had problems with allergy. And that will probably become more important as the vaccine becomes more widely available.
So what about people who are either undergoing chemo or radiation or dialysis, or do any of those things complicate a person's ability to take the vaccine?
No, in fact, it makes it more important for those people to have the vaccine because their risk from the disease is greater. But of course, I'll give you the standard disclaimer, which is, if you have a question, check with your own doctor first.
Well done. Well played. Consult your local rabbi, as we like to say. Right. Could you talk about, sorry, 1 second. Could you talk about any changes? Sorry, I'm just looking through all these wonderful questions. Could you talk about the variant that they found in the UK? Has that variant made its way to America or to Rhode Island specifically?
I don't know about Rhode Island specifically. There are a number of reports in the United States, but I'm very certain that if it's not here now, it will be here soon, just because of the way viruses spread. We did not close down travel between the US and the United Kingdom, which was the only way to prevent the transmission to the United States. What we know is that it spreads faster but doesn't cause more severe disease, which just means that more people will get coronavirus quickly and will tax the hospitals more. and puts more pressure yet on us to get everyone vaccinated as soon as we can.
How often should people be getting tested? And in other words, for asymptomatic testing, should we be going once a month? Should we not be going out during this time of when there's so much virus in the community? Or is it even more important to go get tested now, even if you're asymptomatic?
It actually depends on how you live. So, I'm a pretty big believer that people over 50, certainly people over 50, or people over 50, and certainly people over 65 or 70 should be staying home as much as possible. And if you are staying home and not being in contact with other people, I'm not convinced there is a need for regular testing. But if you are out in the community, if you are interacting with people outside of your household on any kind of a regular basis, in my view, you should be tested twice a week. And do it religiously, as it were, twice a week, because much of this disease is asymptomatic. We have kind of sent mixed messages about testing in Rhode Island. We're big on testing, but we haven't really focused the testing in ways that are most effective. The colleges showed us the most effective way to do this is to test everyone twice a week who's in contact with other people.
I'll ask you a personal question. How has your practice evolved or changed over the past month or two? I think the last time we met, when I moderated the conversation, you were now ordering all your groceries online. You were trying to limit your exposure. Have you changed any of those things, or how have you changed your practice in response to what's going on recently?
I have not changed. I am still severely limiting what I'm doing. And I'm actually trying to decide. I was very lucky enough to be vaccinated a week ago today as part of the effort in Central Falls. I did it mostly to prove to people that it was safe at the request of the mayor and the mayor-elect of Central Falls. I had originally intended to postpone my own vaccination until it was my turn. Anyway, I'm probably not going to get the second shot until it is my turn. And then I'm kind of trying to decide at which moment I can liberalize my movement. One thing worth knowing is the Pfizer vaccine is about 56% effective after one shot, and the Moderna is about 80% effective after one shot. Again, FDA and CDC urge everyone who gets one shot to get a second shot on time. And I think waiting until 2 weeks after the second shot is probably the most responsible way to approach moving around again, to make sure that you're fully immune, or as fully immune as we can get you from the shot. And so it's important to continue to mask and engage in mutual protective behavior because of the need to protect others. And remember, even fully vaccinated, these vaccines are 94 or 95% effective, which means 5 or 6% not effective. And that percentage drops as people age. So for people in their 70s and 80s, the vaccines are more likely 80 to 85% effective. So just because you've been vaccinated doesn't mean you can't get the disease. And the safest time to go, back and re-engage is when 80% of the population or more has been vaccinated.
So I'll ask a question that I'm sure a lot of people are trying to find ways of connecting with others, and it's important to feel connected with other people, particularly during this time of the year when it's dark so early. And obviously, for those who receive their bulletin, there are lots of ways of connecting online with other members of the community. But if you do want to engage in person with other people, what are the best practices? Obviously, I imagine being outdoors is important, but what other activities? Is it bike riding, skiing, walking? Do you still have to wear a mask if you're with one other person and you're sort of by yourself and there's no one else around you? um, what are the best practices for still being able to be in contact in person with people?
Well, masking will continue to be a best practice till this thing is over. Can you get away with not masking if you're walking outside and are 6 feet apart? Probably. But is it a best practice? Probably not. This virus is not passed easily when you are outside, but remember the rose garden. It is passable. People don't remember that most of the original spread happened in Venice when crowds of people were walking through Venice. And so outside transmission is possible, and there's really no downside to being careful other than it's a pain in the neck. I think we're going to be with this until 80% of the population or more is vaccinated. Unfortunately, that's going to be till the summer and maybe till September or October, depending on what the flu vaccine actually is like. One thing that's worth knowing is that the Pfizer vaccine is indicated for people 16 and over, but not children. And the Moderna vaccine is indicated for people 18 and over, but not children, which means that there are no vaccines currently available indicated for children. So it's not likely that children will be vaccinated till the summer or fall. That's not a real problem for kids themselves because they're at relatively low risk of getting the virus symptomatically. But it does mean that there will be a population able to spread the disease until children are vaccinated. So, if you're 75 and the vaccine gives you 80% protection, but you hang around your grandkids and they're not vaccinated yet, that puts you at some, smaller than now, but still some risk, and is worth paying attention to until we get the entire population vaccinated. Like I say, I don't think that will be till fall.
Can you explain, where did Rhode Island go wrong? We were, in the early part of this, I feel like Rhode Island was controlling the amount of spread in the community. We were among the best states in the country. And as you indicated a few weeks ago, we were arguably the most contagious place in the world. What happened?
Well, I would disagree with you about our early efforts. We made reasonable efforts, but we made what I think of as, at least 2 or 3 critical mistakes. In our early efforts, when we locked things down and said people who could work at home should work at home. But we didn't close factories. We didn't close construction sites. We didn't close that kind of thing. And that meant that poor and working people and people of color who have to go out to work every day went out to work. And only about 10% of poor and working people can work from home. So people had to work because they had to live. And so, many of them work 2 and 3 jobs. And that's particularly true of undocumented people. That group of people continue to go out to work every day. And then they brought the vaccine home. And many people who are poor live in densely packed houses. I remember the stories of my grandparents living on the Lower East Side of New York in Coldwater Flats. The same thing is true in Central Falls and in Woonsocket and in Providence today, among the immigrant population. And so people who got infected at work then brought the vaccine home and spread it at home. And that caused the initial part of our spread. That was error 1. Error 2 was believing that when the incidence, the number of new cases fell in the late spring and early summer, believing that the disease was somehow gone, and we let our guard down. That was a moment when we could have and should have really worked hard to vigorously test all those highly densely packed communities and make sure people get into isolation. And we completely failed to do that. And I think the third mistake was the way we did the most recent pause. We had a high level of transmission, and there was no reason to think that not locking down, that if we that we could sort of do some lockdown but not much, and the disease would somehow go away. It clearly didn't, and is going to continue to get worse. And I think we're going to have, a couple of months of pretty tough news as a result. If you look around the world, the countries that did the best pushed transmission to a level of 2 new cases per 100,000 per day or less. That's a level when you can actually control the spread of the disease like that. We loosened up at 14 new cases per 100,000 per day, a very high level of transmission. And that meant we were sitting ducks for the spread of the disease, and sitting ducks because we have so many communities, so many people living in poverty, so many densely populated places that disease spread there, and then from there spread to surrounding communities.
So, aside from another lockdown, what's the way out of all of this?
Vaccinate.
And it sounds like you're creating either we have to go on lockdown again to try to lower the numbers, or just wait till we can get enough vaccine out in the community and have and inoculate as many people as possible. That's sort of the way out of this. Yes.
Well, that's the way out. We seem to be taking kind of the third path, which is, vaccinate as vaccine comes in, which will take a couple of months. Don't lock down, and accept that we're going to have 20 to 30 deaths a day for the next 6 to 8 weeks. And Rabbi, you've heard me talk about this. I'm troubled that we as a state and as a nation and as a culture have accepted that people are just going to die. And we think it's important to keep businesses open. I totally agree. But the best way to keep businesses open is to drive transmission to under 2 cases per 100,000 per day. We felt like we wanted to have our cake and eat it. We wanted to keep businesses open, and sort of thought that we could sort of somehow keep businesses open, bars and restaurants as well, and expect that there wasn't going to be transmission. That's magical thinking. And we knew wasn't going to work, didn't work. And so we had over 400 deaths in December, and I expect to have 400 to 500 deaths in January, and probably an equal number in February in Rhode Island alone. Imagine how we would have reacted if an airliner containing 150 people crashed taking off from Green Airport, and 2 days later another one crashed. We would close Green Airport and undertake a huge investigation. We lost 400 people in December. We're going to lose 400 more in January, and the same number in February. And what astounds me is our sort of willingness to accept this, instead of really talking about how we can and should be different.
Do you anticipate anything being different with, I don't want to make it about politics, but do you anticipate any of the advice, vaccine rollout, distribution, anything to be different after January 20th?
Well, I think the new president will do what he can, but by January 20th, we are going to be in the middle of a very dark time. I don't think he can make vaccine happen faster. His only tool is going to be lockdown. And or masking. And, I think we have a good couple of weeks before we see where this nation is going to land politically, to see if he has the ability to do that. Remember, states have rights, and the federal government has, constitutionally limited powers. We're we'll see.
Are there any local government officials advocating for another lockdown?
They are few and far between. When a state or a city gets in the middle of it, when it's already too late, then they lock down. But what we haven't seen is somebody, my son is living in Toronto. Canada locked down early when it started to see the numbers go up. Their numbers were a tenth of ours, and that's the way you prevent spread. But we don't seem to have the intestinal fortitude to do that. I have not seen that any place in the United States. No, we actually got bars and restaurants closed in Central Falls 2 weeks before the pause. And so we were able to do that one tiny thing, but it was a fraction of what we really needed to do if we were going to really reduce the spread of the disease.
Other people, thank you. I know we're bouncing around. Other questions about the vaccine itself? Other things, people just have a lot of specific questions, things like asthma, things like where can people learn about, can you request a specific vaccine, like the Moderna versus the Pfizer, or is it just whatever's available, that's what you get?
Yeah, I think the competition for the vaccine is going to be so intense for the next 3 or 4 months that you can try to shop location, but I think it's going to be difficult. My guess is most Rhode Islanders will end up with Moderna. Pfizer is a little difficult to mix up, and it's difficult to store. So I think Moderna is going to be the one that's more widely used in non-healthcare settings. In healthcare settings, they can handle Pfizer, but those are not engaged in large community vaccination programs by and large.
Have you heard the side effects that we're learning about? Is it statistically significant? Are they surprising, or is this just part of what happens with vaccine rollouts?
So far, it's what just happens with vaccine rollouts. We expect some allergic reactions. There have been some reports of something called Bell's palsy, which is a temporary paralysis of the facial muscles. But there has not been, to my knowledge, anything untoward. That doesn't mean that we're not going to find a problem with 1 or 2 of these vaccines when we go from having tested them on 20,000 people, which is what they were tested on in their phase 3 trial, to being distributed to 20 million people. Right. We would expect that we're going to run into some unforeseen difficulty, and that's not a cause for concern or panic. It's just part of the way vaccine rollouts happen. And, the one thing, I can find one thing that I'm glad that the Trump administration did was have, sort of have this process of having, 10 or 11 vaccines in development. There were way more than that originally. So that gives us a backup in case one runs into trouble. But then we still have to make sure that we have enough supply of those that are not having trouble. I would be shocked if 1 or 2 of these vaccines don't need to be withdrawn from the market at some point. It's not a disaster if that happens. That is part of the safety process, showing that it works. It's part of the surveillance working. That's a good thing. Believe it or not, a good thing when one is withdrawn, because it means that, the testing has been generally good and that we are being, we are exercising an abundance of caution, which is what's appropriate for this kind of thing.
You had mentioned, I think in a previous presentation, that maybe people who have autoimmune diseases shouldn't take the vaccine or shouldn't get the vaccine. Is that still your position?
Well, I don't remember that answer exactly that way.
Sorry, the questioner asked that way. Sorry. What is, I'll ask it again slightly differently. If someone has an autoimmune disease, should they still get the vaccine?
Well, I think in general, yes. I think the concern is that people who have autoimmune diseases who are on immunosuppressant therapy may not have as vigorous a antibody response. So we will see with time whether they need extra doses or how effective they are in those groups of people.
If you are allergic to the vaccine, what do you do to a component in the vaccine?
Stay home a lot until everybody else is vaccinated. You know, we will get to the point when 80 or 90% of the population is vaccinated, I hope. And I'll say something about vaccine hesitancy in a minute. But when we get to 80 or 90% vaccinated, the disease will stop circulating or will circulate much less intensely. And so at that point, the ability to move around will become much easier, even if you haven't been vaccinated, if you're one of those few people who can't be vaccinated. But the numbers of those people, I expect to be reasonably few. Now, about vaccine hesitancy, initially there were many, many people who were unconvinced they would get the vaccine. We are seeing that flip around. And there may be still some people who don't want the vaccine, and I guess I understand that. But what we're seeing is there's a great demand for the vaccine, and many, many, many people want it. And the one thing I would ask is that people not try to jump the queue, that people wait their turn will come. But there are groups of people who are at much higher risk, both of disease and of hospitalization and death. You know, people who are over 85 probably have a 1 in 4 chance of death if they get the disease. And so those people very clearly should be vaccinated as soon as we possibly can. And it is better wherever possible, you know, to let them go first. There's no rush.
So we're approaching the 1 hour mark. If there's a question you're still want to ask or it hasn't been answered, we invite you to put it in the chat box. But I think we're going to begin the wrapping up process. It sounds like, Dr. Fine, that 9 months into this, we are we can see the light perhaps at the end of the tunnel, but we are still very much in the tunnel. And the next 6 to 8 weeks, even if we are tired and we want to go out and see our friends and see our grandkids and our grandparents, this is the time to continue to practice. This is the time to be even more careful than we were perhaps than the summer. This is the time to remain vigilant of what's going on, and just to be extra careful, to keep masking, to keep, if we have to or need to meet with someone, to meet outside, distance in a way that is mutually protective of each other, and just keep waiting and paying attention to the medical news to see when we can get vaccinated in a way that the doctors or that the government is suggesting that we do it. Is that a fair summation of everything?
It's a fair summation. You know, in the tunnel, light at the end, pretty long tunnel. The one little piece of earlier hope is that last year disease transmission really shrunk markedly after Memorial Day. And I'm hoping that that may happen again. And at that point, with more people vaccinated, it may become a little more safe to move around. So it may not be waiting until September. We may get a bit of a break in the summer, I hope and pray.
Okay. All right. I'm going to turn off the spotlight over here so you can see everyone. And if we could all give Dr. Fine some jazz hands, some appreciation for being with us this evening and answering our questions. We are meeting again next month, where hopefully you'll tell us, guess what? Everything's perfect. Miraculously, all the spread dropped, but we can hope for that, but we'll see what happens a month from now. In the meantime, we encourage everyone to be careful, be cautious, and take care of yourselves, your loved ones, and your neighbors as well. So thank you very much, everyone. Thank you, Dr. Fine. We'll hopefully see you for Zman Kodesh tomorrow morning at 8 a.m. Laila Tov, everyone. Thank you for being here.
Thank you, Rabbi. Thank you, everybody. Good night.